You can see the variation of the biological woman, right? This is the standing position. So patient maybe judge the result, not just only the lying. They're standing and they take a look. But you can see the variation, is kind of maybe some hanging or dangling that you need to explain the patient in advance. So you can see the example result that show that this is maybe the one of the favorite result that patient commonly ask me that, hey, I want this result because it looks simple as biological woman should have, right? So you can see when the labia spread, it look quite natural, and patient want something like this. Patient do not like the okay. So I'm going to the another topic. Is the labia majora now? Patient do not like the labia majora to dangle or be lopsided. See, so you can see that this is maybe a bit difficult to control the skin, but you try your best to stretch the skin, the scleral skin for outer labia construction, stretch appropriately, enough to form a tight labia majora. See, so that it not be a dangle or maybe too much sagging while they're standing. And the internal fat may need to be reduced to prevent the dangling or pretty much prominent labia majora. Some patients expect the labia majora to conceal and contain the labia minora completely, so that like the result that I showed you. So what my recommend is about the ratio. The size ratio of labia minora and majora in terms of the width should be appropriate, and the labia majora should not pull toward either side. Try to avoid like that because it's be more open and not conceal the labia minora. Okay, let's talk to the male urethra that we gonna reconstruct to be female urethral orifice. All patients do not accept the remnant corpus spongiosum in any outcome. So all spongy tissue around the urethra must be totally removed. This is very, very important, right? Because patients do not accept any bulging, or worst case, maybe they're gonna have sexual arousal. It's become even more larger, right? So maybe in Thai patient, they're gonna complain about it. Dr. Thirapong, you have quite a lot of Thai patients to know this problem, very common problem. The urethral orifice should be set close to the vaginal opening as in the correct anatomy position. All patients accept a normal female urination flow and stream. That means of course, they don't want to go with the male pattern again, right? So I think this is pretty standard because we gonna reserve the dorsal urethral flap to prevent the ring scar contraction, right? It's not like the old-fashioned 20 years ago that they cut the urethra like a guillotine cut and make something not prevent the contraction. So the version of patient long time ago got a problem with the contraction with the urethral opening. It's like a very pinhole and difficult for urination. All right, so we go to the how to make the nice vaginal opening. That, in my opinion, this part is really, really important. if you want to make a nice outcome. Most patients do not like a big hole appearance of vaginal opening. So we should construct vaginal opening in a form that look kind of like a vertical oriented as much as possible. So again, this is like an example that you can see. The vaginal opening is look pretty small and very natural in the vertical oriented way. And I would recommend about the distance that you pay attention for the distance between the anus and the vaginal opening. That in norm it should be within 4 centimeters. Some patients concerned about the hair around the vaginal opening. So I'm not talking about the hair inside, it's just the opening, but I think this is the way of education that we recommend the patient who have a lot of hair around the perineum to get rid of hair in advance